Hey, so good afternoon, good morning, good evening, good day for everyone, wherever you are situated in the world today, joining this webinar. My name is Esther Kismödi. I am the Chief Executive of Sexual and Reproductive Health Matters, and I warmly welcoming you on this today session, when you can meet with the editors of SRHM journal issue on self-care interventions and rights-based access. I'm very pleased to introduce our panelists, Manjula Narasimhan, who is a scientist at the Department of Sexual and Reproductive Health and Research at the World Health Organization in Geneva. Hi, Manjula. Also, Laura Ferguson, who is a Director of Research at the Institute on Inequalities in Global Health at the University of Southern California. And Laura is also our SRHM Associate Editor. Hi, good morning, Laura. It's very early for you. Thank you for being with us here. And Pete Chapman, who is the Managing Editor for Sexual and Reproductive Health Matters, and also Alex Bramsey, who is our Communication Manager in Sexual and Reproductive Health Matters. We are using a short half-an-hour session to introduce you this journal issue and the call for papers. The focus of this, as you may have seen, is on exploring strategies for introducing and scaling up access to self-care interventions for sexual and reproductive health, with a specific focus on the needs and rights of vulnerable populations. We are really looking forward to examine opportunities, challenges, and progress using a multidisciplinary lens, striving to identify threats, access across self-care interventions, so as to build and strengthen good practices for evidence generation and action that improves the sexual and reproductive health and rights of all and all populations. So this issue is being produced in collaboration with WHO, Sexual and Reproductive Health and Research Department, and supported by the Children's Investment Fund Foundation. We have an editorial board set for this journal issue. And beside Manjula and Laura, I also would like to acknowledge the other editorial board members, Priyananda, Mauro Cabral, and Georgina Conver. I would like to turn to you, Manjula, and if you could say a couple of words about the conceptual framing of this journal issue. It's very much linked to the WHO normative guidance on self-care interventions, and also refers back to the BMG special issue that was co-produced by WHO. Can you tell us more about definitions and scope? How do we understand self-care interventions in this context?
Sure. Thanks very much, Esther, and thank you for this opportunity to share some background and you know, the thinking that we've had behind developing this particular supplement for SRHM. I'm going to try and share my screen just to show sort of two slides. Many of you may have seen them, but let me see if I can. Can you share? Can you see the screen?
If you could make it big, yeah, super.
Yeah. Oh. All right. So basically, just to show two slides, I mean, we are making a difference in terms of the terminology of self-care, which is, as we understand it, something that's more broad, that includes a range of activities that many of us are already undertaking, including during COVID, you know, in terms of washing hands and physical distancing. elements that can help us not only promote health, prevent disease, maintain health, cope with illness. And this can be whether you are a self-carer or whether you're providing care to another as a caregiver, but areas of health that includes nutrition, doing exercise, physical activity, just sort of what many of us can englobe as in the terminology of self-care. What we have developed a guideline for are self-care interventions. And we separate these two terms out, that self-care interventions are the tools that can support self-care more broadly. And these could be digital health interventions, it could be diagnostic products, it could be information that's evidence-based, and a range of tools that can support that self-care. And some of these can be done with the support of a healthcare provider, or can be seen in transition from something that was initially given within a health setting or in a health facility to something that could be used by an individual. So really sort of these interventions that could be seen in transition. You know, there is still a gray area between, you know, the self-care and the self-care interventions, but the focus of the supplement and the guidance is very much on those self-care interventions and how we can, as Esther said, increase the access, the uptake, the use of quality interventions that can really improve health outcomes for the individual, but you know, that can be supported by a health system. And the framework, I'm just going to say a few words on the framework that was developed to support the guideline, is one that is people-centered. It's really placing individuals at the center of this approach about their own health and well-being. So we've moved away from a disease perspective to really focusing on health and well-being within the context of key principles such as human rights and gender equality, acknowledging that people require health interventions across their life course to different extents, that we need to look at a holistic approach to health and looking at some of those ethical considerations when we talk about the access and the introduction of these interventions. We are acknowledging that people increasingly are accessing health information in products, services, away from traditional health services. So they are still, of course, very important, but there's traditional medicine, community-based support, digital technologies, through caregivers, over-the-counter availability of products at pharmacies or other drugstores. And this is, you know, ever increasing, and particularly during lockdown and COVID, again, this is something that we've seen has increased tremendously. I think Laura will speak a little bit more also about the enabling environment, so I won't talk about this too much, but just to say that just having a quality product is, you know, is not enough. You know, we can be evidence-based product. We could even have, you know, a great guideline, but that's not going to be enough. If we don't acknowledge some of those, the challenges that people face and some of the importance of that safe and supportive enabling environment that are needed, that it needs to happen hand in hand in order for us to make a dent in reaching those health goals and targets. And lastly, the accountability. I think that when we were discussing about this conceptual framework, it was absolutely clear that it was not about handing over the responsibility of health or the use of an intervention to an individual and washing our hands off it. The idea was to develop these partnerships to make sure that the health sector accountability remains, but that we are supporting individuals and communities and families as needed to again, to improve their health and well-being. I'm going to stop there. I'm just trying to keep this brief, but happy to take questions later, and handing it over to Laura, I think. Thank you.
I'm coming back a little bit. Thank you so much, Manjula. Before turning to Laura, I would like to call the attention, and Alex, if you could put up the scope of papers, please, on the screen sharing. As on any health topics, you can use several entry points in which you want to investigate a question. Based on SRHM's focus on rights-based evidence creation and knowledge creation, and also as it is being the focus on many organizations who would like to, including WHO, who recognizes that any healthcare interventions cannot be really successful unless the rights of people is being respected and protected and fulfilled and taken into consideration. So we were very mindful of setting the scope for the papers when we are examining that what a rights-based scope may mean, and Laura will talk to you in more details, but I would like to call your attention to our scope of papers that is elaborated on our website that really calls the attention to 6 strategic areas that you may need to consider when you are submitting your paper. Of course, there can be other issues that being investigated, but we are really paying attention that the rights scope needs to be investigated. What that can be. It can mean to look at the access issues from the quality perspectives and how quality rights quality and evidence-based self-care interventions are linked to particular human rights, whether it's investigating stigma and discrimination, confidentiality and privacy, specific access issues that may link to affordability and other human rights matters. It also we also very welcome papers that looks at specificities about regulatory and policy frameworks that promote accessibility, affordability, quality, and also explores issues around social, economic, political, and legal factors that can influence the realization of rights and determine and responds back to the needs of populations. We also would like to see papers about how can community-based strategies work to improve access and the use of self-care interventions for sexual and reproductive health. And you can find more details what we mean by that. Also, how can adequate information accessible to all potential users promote informed decision-making for sexual and reproductive health? We would like to see papers about the details about the right to privacy, how privacy of all users can be protected. And it's especially important when looking at different population groups that when privacy may work out differently for those who are living with disability, transgender people, people living with HIV, those who live in tribal settings and others. And as Manjula talked about, what accountability measures do we need across various actors, the different levels of the health system and beyond, to ensure choice, autonomy, self-determination, and access to quality interventions. We do realize that integrating rights into research, policy analysis, is kind of clear on the overarching framework, but it can be very challenging when it really links to operationalization, implementation, or when you want to give a rights lens to policy analysis, for example. Laura, can you tell us a little bit more? What kind of papers are we inviting with the rights scope? What do we understand by the rights scope?
Thank you, absolutely, Esther. And let me just also try and share my screen for a minute. And again, I just have a couple of slides that I hope you can see. So thank you, and thanks for bringing us back to the call for papers, which is obviously like really important and a real kind of grounding point for us in all of this. I want to talk a little bit about the importance of rights, gender, and the enabling environment to this call, and really remind us all the time that we're trying to focus on vulnerable populations. And I think that there's consensus that self-care interventions for sexual and reproductive health can be incredibly useful in the world. But we need to recognize that they raise different issues for different populations. And I think that attention to rights, gender, and the broader environment can really help focus our attention on the hardest to reach. So a little bit of background, just as a starting point. You know, we know that when informed by rights, self-care interventions for health can really help ensure access to quality interventions for all. We also know, on the other hand, that neglecting attention to rights in this context can create blind spots that are that reduce the impact of self-care interventions for SRH. From a gender perspective, and I think this is really important, we know that women, men, and trans people have different motivations for using self-care interventions for sexual and reproductive health. They also face different potential barriers to access. And yet we don't really know very much about what these are and the influence of gender on access to and uptake of self-care intervention. I think that's an area that's really important to dig into. And ultimately, you know, and Esther's alluded to this, we know that all self-care interventions are implemented within specific legal systems, health systems, cultures, geographies, populations, and way more than that, all of which influence how they might best be delivered to reach all those who might need them. So this kind of sets the stage for a range of issues that we really need to think about if we're trying to make sure that we can reach the most vulnerable with self-care interventions for sexual and reproductive health.
Laura, would you be so kind to put the full screen? I think some people may have a difficulty to look at it when it's in a slide mode. Can you put the slide on full screen?
It is on full screen in my thing.
It's fine. It's fine.
Sorry, does that help? I'm trying to make it bigger, but it's in slideshow mode for me. Don't
worry, it's fine.
Sorry, I don't think I've got anything that's too small, but I'll talk you through it. So I did want to start a little bit with the enabling environment piece of this, which is really important. There's no single way to deliver self-care interventions. When you think of the range of interventions that's encompassed, and as Manjula's just described, and also the different settings in which they might be implemented. So there's no roadmap of like, how do you do this? But what we can do is flag a few issues that might be important to think about in the context of delivering self-care interventions. And I've listed them out here. I won't go into all of them in detail. I'll try and flag a couple. And remember that what we're trying to do is learn from intervention experience, learn from the work that you've all been doing. So for example, in your implementation efforts, what attention have you given to the legal and policy environment? And one area where this comes out a lot is with community health workers, who could play an important role in some places in helping facilitate or deliver self-care interventions for health, but there may be a policy that limits the types of interventions that they're allowed to do. So if we really do want to use community health workers as an entry point, it might be important to visit that policy environment and really see what is this cadre of the workforce allowed to do or not. The regulation and quality assurance mechanisms is also a really important thing. You know, if we're talking about making products available online or in shops around the country, how do we ensure that that the quality is maintained? The other one that I'll flag really quickly is the location of self-care interventions. And again, I want to think about this from the perspective of different groups of users, different populations, right? There's a difference between making a self-care intervention available at a pharmacy where it might be like in the community, so very convenient, but you might have to pay for it, versus making it available in the health facility. So it might be free, but you might have to pay for the transport to go there, and it might take you time to go there. So for different groups of people, there may be pros and cons to each of those. I think it's really important to understand, again, making sure that we're not just reaching the easy to reach, but we're really getting out to everybody. And obviously, I mean, I have to mention that how you connect people to health services is critical in this. Like Manjula said, this isn't a replacement to the health system, it's an adjunct to. So how to best ensure that those links exist and are strong. So that's kind of the big picture environment that I wanted to talk about. I'm very happy to go into it more, but I did want to also mention a little bit about some of the rights that seem most relevant in this context of self-care interventions for sexual and reproductive health. I don't want to limit you to these rights. Feel free, please, to consider other rights too. But these form the rights framework that fed into the guideline that Manjula was talking about earlier. And we're really interested in seeing how people are giving attention to these different rights in their work, in terms of how might they inform the design of interventions, the implementation, or the monitoring and evaluation. Again, I'm not going to go through all of them. I hope that's big enough for you to read, but I'll pick out a couple. Non-discrimination. So again, I'm going to bring us back to the most vulnerable, the most marginalized, the hardest to reach. So how can consideration of non-discrimination help inform how these interventions are made available? And to recall, non-discrimination does not mean let's treat everybody the same. It means let's make sure that we can really reach everybody, whatever that takes. Esther said a little bit about the right to information and informed decision-making. You know, how do we make sure that people access easy to understand information that can help them make informed choices about, first of all, whether or not to use a self-care intervention for sexual and reproductive health, second, to know how to use it, and third, to know what to do if further assistance is required if they need to access services. And then finally, accountability, which Manjula has already mentioned as well. It's fascinating and really complicated in the context of self-care interventions for sexual and reproductive health. But, you know, there are really important questions to ask about who's responsible if things don't go according to plan. So who's responsible if a fertility regulation app fails and people get pregnant? Who's responsible for the quality of products that are purchased online? How do you guarantee the quality of those? What are the mechanisms for that? So there's a whole load of issues to unpack there. So again, I want to take a step back and leave you with a few kind of bigger frame questions that we're really trying to learn from you about. You know, we want to bring your experiences to the broader world who's interested in self-care around sexual and reproductive health and rights, and how rights has informed this, how attention to laws, policies, and regulations has helped inform your work and improve your work, and how this understanding of the context is really critical, from constructions of gender to who bears the cost of interventions, geographical access, legal barriers. I mean, I could go on, there's so much in there. But this is the evidence base that we're trying to contribute to through this journal issue. And so what we'd really love to do is be able to help bring some of your experiences around all of this to the fore. So again, I'll stop there and hand back to Esther for now.
Thank you so much. So in the last part of this session, we would like to also give you some practical information about how to submit and what important issues to consider when you are submitting your article. I also would like to emphasize that it's always very important to look at the journal profile when you are submitting your article, and of course the call for papers. SRHM really has a multidisciplinary profile when we are very much welcoming papers with a multidisciplinary lens, and we are appreciating authorship from on an equal basis from academics, researchers, policymakers, implementers, advocates, and activists. And the most important is those who has an invested interest to articulate rights-based considerations. So I'm turning to you, Pete, from the managing editor perspective. What do you think the most important points are that you can advise potential authors for this issue?
Thanks, Esther. Right, so as Esther said, I'm going to be talking about the sort of the more practical details in terms of the editorial aspect of things for the self-care interventions issue. So I'm going to start off with a very brief overview of the journal. Hopefully you're familiar with SRHM. It's an international peer-reviewed and open access journal that publishes 3 issues per year usually. That's an the open issue, which is across the scope of sexual and reproductive health and rights, and 2 themed issues usually, which are on a more specific topic. As Esther said, it's multidisciplinary, and the indexing, which you may be interested in, the journal is listed in PubMed Central. It's also indexed in Medline and is accessible via PubMed, and it's also indexed in Scopus and the Social Sciences Citation Index, belongs to Clarivate, among others. The homepage of the journal is listed in this URL, but it can be accessed very easily from just www.srhm.org. Our publishing partner is Taylor & Francis, so when you submit and when you receive information from the journal, you may find some information from Taylor & Francis. That's our publishing partner, and they work with us in terms of the journal processing. I'm going to move on to the call for papers for the self-care interventions issue now, and hopefully you've all seen this in some detail. Again, this is accessible via srhm.org, and the submission section just gives some details in terms of what our expectations are in terms of editorial requirements, how to submit, deadlines, etc. So I'll just go through some of the more important points now. The full instructions for authors, which again Esther mentioned, and we would strongly advise you to go through before submitting those instructions to authors, can be accessed via the Taylor & Francis website, which you can access via srhm.org. So you can access all of this information via SRHM's website, but it may take you to the Taylor & Francis site. But as mentioned, that's our publishing partner. The main article types, broadly speaking, that are probably going to be the most relevant for this issue are going to be research articles for primary research, review articles for secondary research, so whether narrative reviews or systematic reviews. In addition, we've also got commentaries and perspectives. As I mentioned, the full details of those are provided in the instructions to authors, particularly with regard to word count and reference, number of references, etc. And there is some leeway in terms of the formatting requirements for those, but obviously those kind of provide the main criteria that we're asking authors to meet. In terms of authorship, as one would expect, we require all authors to meet the International Committee of Medical Journal Editors criteria for authorship. There's a link to that resource in the call for papers. And in terms of article processing charges, as we're an open access journal, waivers are available for this issue, and there are 2 routes that authors can request waivers via. And these are based on World Bank classifications. Again, the full details are provided in the call for papers, but briefly, the first is for corresponding authors whose primary affiliation is in low-income economy, as classified by the World Bank. And there's an option on the submission site that says I'm eligible for and request a 100% waiver. So if that's applicable to you, then please select that option on the submission system, and then it'll be processed via the appropriate route. Alternatively, if the corresponding author has a primary affiliation in the country that has a lower income lower middle income, upper middle income or high income economy, according to World Bank criteria. We would ask that you select the I have a waiver code discount option, and there is a waiver code that is available on the call for papers, and you can input that on the system, and again that will be diverted via the appropriate route. And importantly, if you could specify in your cover letter that the article is intended for this for the self-care interventions issue, and there should be an option to select that on the submission system itself that will facilitate its processing and make sure it goes via the appropriate route. In terms of how to submit, there is an online submission and peer review system, which some of you may be familiar with, hosted by Editorial Manager. The URL link is here, but again, this is accessible via srhn.org. It will take you via the appropriate link there to the submission site. The submission deadline for the issue is the 31st of March, so there's still some time, plenty of time to submit. The submission site itself is hopefully fairly self-explanatory, but if you have any queries, then please don't hesitate to get in touch with us. That's my email address at the bottom there, and you can contact me, or feel free to contact the editorial dedicated inbox, which is editorial@srhn.org. I think that covers the main editorial details. So I'll hand back to Esther, and I believe we may have time for some questions. So over to you, Esther.
Thank you very much. Thank you, Pete. So we covered our 30 minutes that was dedicated to our presentations, and we just stayed for another 10 minutes because there very important questions came through, both on the content and on some technicality issues. So I think there are a couple of questions that is dealing with the profile, and this is when I think Laura and Manjula, I would ask for your advice. That one of them is about that from Citi, from Indonesia, that you are doing some research mixed study or a survey among adolescents on media, and you are asking whether it's suitable for the team issue. There is another question that came from the private chat that you are doing some survey on medical abortion and whether and access issues for marginalized populations in a given country, whether these issues are relevant for the issue or not. I would say that both issues are very relevant, but we are expecting a rights angle and the rights focus. So Manjula, Laura, do you have any specific comments that is illustrative that yes, the topic is relevant, but the topic doesn't define by itself that it's rights-based just because we are talking about adolescents or medical abortion, that itself is a rights issue, but we are looking for particular rights angles to be examined. Manjula, Laura, would you have any comment, some useful comment on this?
I'll just maybe say quickly, there's also two questions in the Q&A part, Esther, I just wanted to flag.
Yes,
yeah, but so I'll let Laura maybe respond to the rights issue. I think it would be really fabulous to be able to get examples of sort of either implementation or, you know, how rights, gender equality, equity have been addressed in the different settings, whether it's Indonesia or elsewhere. You know, and like you said, Esther, it's not just linking with certain populations that automatically ensures that a rights approach has been taken. So it would, but if it has been, it's wonderful to be able to hear what have been some of those opportunities and what have been some of those challenges, because it can not only help other similar settings, but you know, help us ensure that as we move forward and you know, develop implementation tools for one or more self-care interventions, that we are building in on those experiences that you have at country level. And I think that if we can get also feedback from you know, the communities, the affected populations, if they're included in those papers, I think that that's also quite important, because the data, you know, feels should be really owned by the country. Over. Laura, over to you.
Laura, before you elaborate on this, I would add another question so you can respond to that one as well, that what we are expecting from commentaries. So I would turn to you on both questions.
Thanks, Esther. I mean, to be honest, I don't have very much to add to what Manjula said. I think what we're really keen to explore in this issue is an explicitly rights-based analysis. So the interventions that were described sound fantastic. They sound really interesting, but it's hard to say from that amount of information how well they fit the call for proposals. So I think that what might be useful is if you have an article that you've been working on or something that you think might be appropriate, that you refer back to the call for papers, because we really gave a lot of thought to the different areas that we've asked questions about within the scope of the issue. And also you can use the slides. Sorry, I realize there were technical issues with my slides. We will post them, but that gives you an idea of how we're thinking about rights and which rights and the broader environment. And so I think really trying to make sure that some of those elements, and of course it's not going to be all of them, but that some of them are implied within the broader context of a rights framework is kind of a key part of any papers here. And I think in terms of commentaries, just briefly, the call for papers is the same irrespective of the type of article. The different types of article, I believe, are well described on our website. So in terms of if you're trying to decide what type of article does my work best fit into, the website's the best guide for that, but recognize that the call for papers, the scope of the issue, will remain the same across the different article types. You're on mute, Esther.
Thank you. Some practical questions, Pete. I think there are many questions about the word limits and practicalities. All of them you can find on the Call for Papers website. So I wouldn't spend time on that. I think it's an interesting question that's always coming up, that when authors don't know about whether the paper fits or doesn't fit into the particular issue, can they share a 300-400 words document with the editors to get some feedback about the relevance? I don't think that the editors at this point would send detailed comments, but really a feedback about the relevance of the research and the analysis for the journal issue. Pete, what is the approach about that?
Yes, I think, that is a good question. I think it comes up regularly with different calls for papers. I think, going back to what Laura said, I think it is really important that when putting together any article or any sort of executive summary for an article, that you do go through the call for papers and make sure that you are incorporating all of those ideas and those frameworks that are specified in the call for papers. I think that's key. I think, again, the topics may well be of interest, but ensuring that there is a rights-based framework, and we are you're mentioning all of the various elements that we want to be discussed from the call for papers. That's going to be key. So I think making sure that you specify very clearly how that's going to come about, I think will enable us to give you a more accurate idea of whether the full paper will be of interest. And as you say, Esther, the details are all on the Taylor and Francis website in terms of which article type may be the most suitable. I think, again, what we've found in other themed issues and other special issues is that there are some papers that seem to fall through the gaps in terms of the different article types. So if you're really stuck in terms of not knowing which specific article type your manuscript would be best suited to, then again, do feel free to get in touch, and we can perhaps give some advice on that. But yes, sort of again, the key points are, as mentioned, making sure that everything is sort of fully done within the scope of the call for papers, and consistent with the information on the submission guidelines as much as possible, and that would put you in good stead for some meaningful feedback from the editors.
Thank you very much, Pete. And the last two questions, one I can answer very quickly. Andrea, you were asking that how many individual papers you intend to publish, how many submissions do you anticipate? It depends on the topic. Some of the issues, call for papers, are very popular. Some of them are less, depending on the topic. Sometimes we receive 50 papers, sometimes 100. Our so far biggest issue that has been published is the universal health coverage issue that has 26 papers, I think. But you don't need to worry about that. Each of the paper is considered on an individual basis, is being submitted for a peer review. So one paper is not competing with another paper. Each of them are assessed on its own asset and whatever message it communicates and how it's built up. There is one question that I would, I think, address to Laura and also Manjula, if you may have any thoughts on that. That how to incorporate the rights-based perspective in a quantitative paper like an RCT. It's a very interesting question, and we will, I would like to emphasize that we will have a seminar series about how to incorporate rights into research. So please look for this seminar series in the coming year. With 2 sentences, Laura, how would you respond? I mean, what kind of advice could you give to authors on that?
Sure. I mean,
encouraging that the rights-based perspective is encouraged to any kind of research, right?
Absolutely, and it's impossible to do this in 2 sentences. But let me try. I think that it's very possible to incorporate attention to rights in RCTs, and honestly, it's easiest to do from the design stage, because how do you think about who the target populations are within the RCT? How do you think about how vulnerability is defined? That might help you help you choose your target populations. But also, I mean, it can be going beyond the traditional endpoints of an RCT in terms of efficacy or effectiveness, but looking at the processes of how things work. Is community participation an important part of this? How is the quality of interventions assured? How do you know about acceptability to the community? So not just does this work, but why does it work? What are the bits that they like? What don't they like? So I think that there's a lot will depend on how participation has been considered, how non-discrimination is being framed within the broader environment, and recognizing that an RCT isn't necessarily like a real world setting, but we can still glean useful lessons that it can inform, like how we think about that broader enabling environment as we move into broader implementation. So I'm sorry that's really insufficient, but hopefully it's a starting point.
Manjula, do you have any additional comments on this or anything else?
I mean, we've just, it's been interesting. We've just had a series of discussions in the department on, we had our Gender and Rights Advisory panel, and we had a discussion specifically on how do we include gender rights and equity into research and on SRH. And, as Laura said, I think sort of the meaningful engagement of stakeholders and community from the start of the process, not just developing sort of a research proposal and then sort of bringing on people for more sort of the rubber stamping. I mean, there are ways of ensuring that at least the thought and the planning behind incorporating some element of right and equity and the gender considerations is done meaningfully from the start and to the completion. There are examples of that, and we can refer to, I can refer to the guideline that we did previously on SRHR women living with HIV, where we took a systematic approach to meaningfully include a diverse community of vulnerable women living with HIV. It is possible, and there are examples of that. So I would encourage for people to, it's like Laura said, it's hard to do in these 2 sentences, but I think it's certainly important, and I think that's maybe what we would also be looking for in the supplement.
Thank you so much. So really a very short, quick answer, Pete, and for all the participants, I think I keep screening through the questions. Most of the answers are available on the website, so please look at both the call for papers and the instruction to authors link on our website, because many of the answers are available. I think what Pete is not really available on our website, because it's really an individual processing of a journal issue, that what the authors can expect about timelines.
Sure. So, I mean, obviously, as an open access journal, we want to provide as efficient a service as possible. And we obviously aim to have first decisions, which are obviously very important for authors, as quickly as possible. In terms of the actual processes, so as mentioned earlier, we have an editorial committee, and so papers go through initial screenings and consultation with the editorial committee members, and then those that are suitable for the we feel that have potential for the issue will then go for external peer review. At the moment, in terms of the timelines on the journal, we're looking at an average of around 34 days from submission to first decision. And obviously, as I say, this is an average. So we can't say for an individual paper that that's guaranteed, but certainly this is something that we look to make as efficient as possible. So we would aim to have a first decision for a paper that's put into peer review in around 30 to 35 days. And in terms of the timeline from submission through to acceptance for papers, again, it's hard to put a clear timeline on that. It very much depends on what the article type is and how much work is required. So some papers may need more work than others. Some may need some mentoring where an editor works directly with the authors. So we would say that it could be anywhere from between 6 months to potentially 9 months from submission through to acceptance for papers, and that's a rough guide. And obviously there are papers that that absolutely fly through peer review and published very quickly. And obviously there are those that take quite a bit of work. So, but either way, it's the editors are investing the same amount of input into them and making sure that everything that we publish is meeting all of the relevant criteria and making sure that all of the quality control is in there. So if you have queries about a submission and you're wondering where it is, then again, please feel free to email us and we can give you an update on a specific paper. But as I say, we aim to have a first decision for authors within 35 days. And submission through to acceptance, we would hope to have by six months. But as I say, it can be a bit longer than that.
Thank you so much, Pete. And I think we came to the end of this session. We really appreciate your patience and all your questions. We intended to have 30 minutes. We thought that, we can do it very quickly. And it was a field test. We have never done this Meet with the Editors webinar. And we thought we do it quickly because who cares what is in the call for papers. At the same time, we anticipated that actually a lot of people care. And it might be very useful to have the opportunity to answer your questions and give some more details about the call for papers, and also have a face to us that actually we are very ready to respond. We are not just a black hole in the internet with the title of srhm.org, but we are people here and we are very, very happy to communicate with you, answer your specific questions and give directions and advice, and also learn from you through your questions how we can improve our services to you. So thank you so much, Laura, Manjula, and Pete, and thank you, Alex, for putting together this webinar and session. And thanks all the participants and all colleagues and friends who participated in this session, and have a nice rest of the day. And we are looking forward to receiving your papers. Thank you.